You're tuning into the Active Mom Podcast with physical therapist Dr. Carrie Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show. All right, I am so super excited to talk to our next guest, Dr. Stephanie Waggel. She is a psychologist who specializes in perinatal mental health. Psychiatrist. Oh my gosh, I'm so sorry. I messed it up already. But anyway, point being, mental health, I feel like, is something that we talk about so much more now than we ever have before. And I get a little FOMO because I feel like I wish we had, kind of these resources, even 10, 12, 13 years ago. So Dr. Stephanie Waggel, thank you for being on the show.
Oh, yeah. I had to make the differentiation because
thank you for doing that.
Well, it's kind of analogous to optometrists and ophthalmologists and podiatrists and orthopedic surgeons. Like, people get them confused. So one goes to medical school, and that's what I did. So I did all the rotations, delivered the babies, was in on. I actually have a license to perform surgery, but I mean, I wouldn't use it. I don't.
Good to know.
Go through all that stuff. But one of the main things that I do is prescribe medication specifically to pregnant women.
Right.
And psychologists, to my understanding, aren't able to prescribe. They get like their PhD, and they do their like psychoanalytical training, the Freudian type stuff, which I guess I could get into. But I'm really into the medical aspects, like medical management. I order labs, I order EKGs. I actually touch patients, doing, which is, good now that for telesessions, I couldn't really take people's vital signs. Now people are back and I can check their blood pressure. So I do mostly medical things. Now I can do therapy and things like that, but just the demand for medication management is so high, especially for the pregnant population, because it kind of scares the prescribers. Yes. The liability, they're hesitant, and they're like, I'm afraid. So I specifically work with pregnant individuals on their medication management, but it gets confused all the time. In fact, other medical doctors confuse it.
I'm glad you said that, and I'm so mad at myself because literally I just didn't read my own notes here. But that was actually one of the questions that I had later on, is like, how does a mom decide, one, if you need help, and two, where to go and who to see? Because I'm sure a lot of people get psychologist and psychiatrist confused. So like
all the time.
Let's say I'm like, okay, because you probably have a couple different type of clients, like some that may already have some medical management and then they get pregnant and then they've got to figure out what to do. And then somebody that maybe they start to navigate issues in pregnancy. So let's start with like the first one where, maybe they've been navigating some issues mental health wise, and they're thinking about getting pregnant. Where do you kind of like, where would you start with somebody like that?
Okay, so good question. So I think another differentiating point is typically the psychiatrists call them patients, but psychologists call them clients. That's just an observation that I've noticed. So I mostly see people of reproductive potential, which typically includes young women. And so just right off the bat, I don't prescribe things that they would have to come off of while they were pregnant, because that would just be silly. and okay, I got to give my disclaimer that this is not medical advice, because
of course
it's got to be tailored to every individual person. But as a rule, a medication that I just do not prescribe to anybody of reproductive potential is Depakote. So just right off the bat, even if they're not pregnant, I don't put them on things that would be what is called teratogenic, which means it would be harmful to the fetus. But honestly, aside from Depakote, that's all the other ones are pretty much fair game. The rule of thumb is if it worked when you were not pregnant, continue it, because that's going to work when you are pregnant. So to get started, people typically have some sort of like third party that says like, you don't seem like yourself, or you might need some help, or that sort of thing. And so they probably go to Google or ask one of their friends. And I think their primary care or OB or pretty much any medical professional that they have a relationship with, they'd start talking to them about it. And in my experience, a lot of medical professionals are like scared of mental health and pregnant women.
Yes.
And so they're like, oh, I
100%
don't know what
yes.
to do.
Yes.
So they'll typically go to a therapist, and so they'll work on strategies for dealing with stressful situations and coping skills, grounding techniques. They'll talk through stressors that are going on in their lives and that sort of thing. But they cannot prescribe medication, which is actually where I come in handy. And so when it gets to the point where the therapist actually says, okay, I think that you might benefit from a medication, that's when they would get a referral to an individual like myself.
All right. So quite often I have moms that will be like, hey, I'm thinking about getting pregnant. I'm on these medications. Um, am I going to have to give them up? Am I going to have to navigate my mental health issues without medication to get pregnant? And that can be really scary. So for somebody like that, is that kind of just fear? Is that misinformation? What can we tell those people?
Well, as I alluded to earlier, that a lot of medical professionals aren't comfortable, especially with the liability. I have a little talk that I give, and it's on my YouTube. It explains that when you tell your medical professional that you're planning to get pregnant, immediately, instead of, because in general, you give them the benefit of the doubt, they want to do no harm. So the harm that they're thinking of immediately is the harm that would come to taking a medication. But what they don't think about is the harm to stopping the medication.
Right.
So, for example, a pregnant woman with asthma goes to get her steroid refilled, and the pharmacist, I mean, these are real life scenarios. The pharmacist sees that she's visibly pregnant and says, no, I don't feel comfortable with you taking this while you're pregnant. And it's like, okay, because if they prescribed it or they dispensed it and something bad happened, then
Right.
they're in trouble. But what about when she has an asthma attack and she can't breathe and a bad thing happens? I guess they're not on the hook for that because they don't have anything to do with that. So it's more of people tend to lean on leaving people alone and not doing anything, but without realizing that that in itself is detrimental.
Right. It's funny though that you talk about, when people get pregnant, everybody gets all scared all of a sudden. We run into that in physio all the time, like especially with orthopedic PTs, because they think if they touch like a certain part of your foot, they're going to spontaneously put you into labor, which cracks me up. Yes. It cracks me up because both my kids, like my first one had to be pried out of my body. Both kids came at 41 and a half weeks. I'm like, trust me, if that was going to happen, I would have signed up like way earlier. It just doesn't work that way. Like people are really scared that they don't. And I do think a lot of decisions come out of fear and not like, all right, well, maybe, being on that medication is actually better for the mom. It'll be a much better pregnancy, and instead of just going based on, oh no, just in case, that kind of stuff. So I think that happens a lot across medicine for sure.
Yeah.
What are
I've heard of that ankle place that you touch, and I researched it a little bit. You probably know more than me, but my findings is if that actually were the case, would that not be used to induce pregnancy?
So it's funny. I used to work with an amazing acupuncturist that she was a physician in Lithuania and then came to the States and became an acupuncturist. And so she had this lovely, calming Lithuanian accent, and she was really smart. And we tried freaking everything. And it just brought me to this understanding of if you're already going to go into labor anytime soon, yes, these things can kind of help stimulate it and move along a little bit. But if everything's shut down, touching somebody's foot, like you're not that delicate. Like just be honest. It's not like we're a vending machine and you push the foot and a kid pops out.
Right, exactly.
I wish, trust me, I wish.
Yeah, that would be good for some people if it were the case.
I would have signed up for that. I would have paid extra for that. Like, no, it just doesn't work that way. So you've got somebody, they're consulting with you, you're helping them manage their medications. Let's say they've gotten through pregnancy. What is your role at this point? Kind of looking into postnatal issues, breastfeeding, kind of all of that. Where can you be helpful here?
Well, a lot of times I've noticed that, and we can even blame hormones. So there's something called allopregnanolone, which, let's just say, it functions to decrease anxiety. It itself decreases after you give birth. So if you have something that was decreasing anxiety, your anxiety is going to increase. So I definitely like to see people more often just to keep an eye out, because the hormonal changes can be pretty brutal.
Yeah.
And then in terms of breastfeeding, so there are definitely certain medications that I would be more cautious about breastfeeding. Some, just an example for, like, if I'm treating somebody with ADHD, things like Adderall are excreted, like, percent wise, a little bit higher in the breast milk than things like methylphenidate, Ritalin type picture. So there are changes that can be made, but honestly, I always like to fall back on, if it's working, stick with it, because you don't want to experiment with new, tapering off an old medication or starting a new one, like when somebody's going through this very fragile state of life. So I definitely keep a closer eye on people. I see them more often. I follow up. And one of the biggest things I see postpartum is the increase in unwanted and intrusive thoughts. So I think if somebody is having these and they're not really well versed in mental health, or they come from a family where they don't talk about mental health, a lot of times they actually label themselves as crazy. I don't like to use the word crazy, but people that aren't in the field use crazy. So I'm just going to say crazy.
Gotcha.
And they're like, oh, I keep having these awful thoughts. And I won't give any examples, but they're usually like the worst possible thoughts you could come up with. And they're like sticking in their head over and over. And they're like, oh, I'm insane. I need to be institutionalized. And then I tell people, like, actually, this is really common and it's pretty easy to fix. But you just have to actually, first of all, like, go get help for it. And second of all, once you talk to me, and I don't know whether it's my algorithm or what, but I've been seeing a lot on social media from moms that are talking about these unwanted, intrusive thoughts. And I feel like I just saw, is it Jennifer Lawrence hired a bodyguard because of her unwanted thoughts about her baby? And so I guess it's coming more mainstream, but I've known that it's pretty common, but people that aren't in my field or don't have the same algorithm on social media might think that they're the only person. And I love telling people that they're not crazy and that this is actually pretty easy to fix.
I'm so glad you brought that up, because I feel like, again, in good news, bad news about social media, you are hearing other people say the things that are or were in your head. And I know, like, I very much remember my oldest did not sleep. I remember driving. We had this little loop that included I-66, and you're outside the Beltway here in Virginia, so you understand this. That if I did it going right into HOV, it was fine because there was no traffic. But like, and we just had to keep driving. And I distinctly remember thinking one day, I'm like, oh, there's a telephone pole. That's really interesting. And but I also remember thinking that I could never say that to anyone, because if I said that to someone, they would take my baby
to the hospital.
And they would be like, you're messed up. I'm going to take your baby. You're an unfit mom. And I remember, like, literally not verbalizing that until a couple of years ago. But yet we've got moms saying it now. So, like, how do you know when you're like, okay, normal thought, all good, and normal thought, and girlfriend, you need to, like, chat with somebody and we need to kind of get a handle on this? Like, where's the line there?
Well, for a non-professional, any of these unwanted thoughts, you should say, girlfriend, you need to chat with somebody. For me, again, this is not medical advice.
Exactly. Entertainment purposes only.
Yes, entertainment. One of my earlier jobs was actually to do an analysis of people who have either tried to or successfully jumped the White House fence, to see if they are actually a threat or if they were just wanting an autograph. You know what I mean?
Okay.
So years and years of training in determining whether someone is likely to do something or not. I
Mm-hmm.
got that background in training. So this is just an example. A mom has the unwanted thought about hurting the baby. Typically, if she's coming to me from her own volition and she is deeply disturbed and wants these to go away, which is a word called ego dystonic. These thoughts, I always say, like, if you had a big red button and you could push it to make these thoughts go away, would you push it? She's like, yes, I hate these thoughts. That's why I'm seeing you, make them go away.
Yep.
Then it is, in fact, very unlikely that she's going to act on them.
Oh,
it's
good.
more an anxiety picture. And that, in my experience, probably not for other medical professionals, are probably like, that's not easy to treat. In my experience, it's really easy to treat. I would say 95% of my patients with these unwanted thoughts, the treatment that I give to them works. And then they're like, wow, that was easy.
Right.
Now, it is a bit more difficult when you have the other hand, the ego syntonic. Usually they're not coming in for help. It's a husband or family member that's like, I'm bringing. And I'm like, okay, these thoughts, do you want them to go away? And they're like, no, they're true. They're real, I believe. And then it makes me think, okay, there is unfortunately some potential for some harm to come. Those are the situations where typically you do kind of end up in sometimes involuntary care. Sometimes I can convince people to go to the hospital, but obviously if I have determined that someone's going to get hurt, like, they're going to have to go to the hospital. I rarely see it, but even in those cases, there's medication. And if you could just convince the person to take the medication,
right.
I'm trying to think, like, statistics wise, like I said, with 95 on the other hand, this is a case that I see less. So I'm computing, I'd say 80% of the time we can get those to go away. Those medications would be like antipsychotic medications for the dangerous egosyntonic thoughts about harming the baby, but it's anxiety meds for the other one. And that's outpatient, and I'm not going to call the police or do anything.
Right. So, I think that's, I think that's really important to know too, because you're sitting here having these thoughts and you're like, this is messed up. I shouldn't be having this thought. That's actually a good sign. That, like,
exactly. It's a good sign that you're bothered by it.
Yeah.
I have seen women who have never had a mental health condition in their life, perfectly fine, give birth, and be absolutely convinced that their baby is a demon. I have seen it. We give antipsychotics and then it goes away eventually, but it happens. So if you are bothered by the thought instead of the thought sounding like it's plausible, that's not an emergent. We're not going to put you in the hospital for that. That's it. Well, in my experience, it's incredibly common. I see at least 2 people every day with that.
With this, like, what, I'm going to blame hormones, but like, what brings this on? Do we have a sense? Can we predict and say, hey, you know what, this might be a possibility? Do we have a way to kind of anticipate some of this stuff? Or is it just kind of, we see what happens after delivery?
Well, this is where I get a little bit cynical. I feel like if this condition affected men, we would have an answer.
Oh, girl, don't even get me started.
I won't get into it.
Safe place here, by the way.
Okay, maybe I will get into it. What I'm going to say is that it wasn't until 2023 that the first medication pill for postpartum depression was approved. Like, literally that. Before that, it was just generic antidepressants that weren't specific to postpartum. So that being said, there just isn't the research or interest. I'm interested. You're interested. We just have to convince the billionaires to get interested. So to say, oh yes, it's this specific mechanism that happens after delivery. Like I said, the allopregnanolone, and that's kind of what the specific FDA approved for postpartum depression pill that I haven't even been able to find whenever I do my prescribing. It's so new. It's like not even coming up in the registry, and it's ticking me off a little bit. But that's kind of what that's looking at. And so that's as much, I'm sure there's like deep research, but of course it's not highly publicized, or most of it is done by the companies making the medication. So you have to take it with a grain of salt. So there's no good answer like this specific change in hormone, but the sex hormones, and like I said, the allopregnanolone drop, I'm fairly confident it's hormones.
I
Which
think we're all
ones,
on
how
board with that.
much? Yeah,
Well,
and
estrogen takes this like it just like skyrockets and then just goes in the dumpster afterwards. And I feel like we're not even I feel like this is the year of estrogen for me as far as I'm concerned, that like there's so much that we are not taught early on about how estrogen impacts so many other parts of our body and our brains, that we're literally taught in like 5th through 7th grade. Estrogen makes you a girl and testosterone makes them a boy. And it's literally so much more complicated than that. And
oh
I
yeah.
have seen more studies come up this year about and it's interesting because it's coming up in the menopausal space, and I think we can take some of that information and kick it back to other low estrogen states, which is
Yes.
postpartum, but looking at dementia and kind of all that stuff too. And I'm like, yeah, I'm pretty sure I had dementia after I was
Oh,
postpartum.
pregnancy brain, don't get me started.
Like there are parallels there. There are parallels, and it's estrogen,
Yes.
I think.
I wish it was its own like residency or fellowship after medical
Yeah.
school, studying postpartum period and menopause, because
Yes.
we all know that something's happening. Why do we not know why or how to deal with it? And it's just this like vague, unexplained mystery, uh oh, it's just you're a woman, or like what?
Right.
No,
Exactly.
like no, we need science
Exactly.
here. Let's do science.
What's really messed up though, and it drives me nuts, having gone through a couple of pregnancies, I feel like I should have a handle on this. This is, my sweet spot. It's not literally until looking backwards and be like, oh my God, there is so much parallel. And we need to make that connection more. We need to educate women sooner. And instead of having to get caught up in menopause, we need to have these conversations before women get pregnant so that they know that these hormones they're not going crazy. These hormones can
Yeah.
affect your brain. They can affect your
Right.
tissues. They can affect like so many different parts of our body. And these are the times in our life which you will have major fluctuations. My daughter's 10 and I'm like, oh my God, she's going to get her period soon. And I'm like, we need to be having these conversations ASAP.
Yes, that's true. None
And
of
my
this
son
like
too.
we don't talk about it, taboo, then they
Yes.
feel weird about it. Or I have my 4-year-old reading Netters and Grey's
Yes.
Anatomy. My husband's probably really disturbed. I'm like, no, babe, we have to start her now. And he's like, oh, okay, you're
So
the expert, sure.
I love that. My husband and I, we moved in together. I think we were like dating for 2 years and then we got married 4 years later. And there was always like some varying degree of like model of genitalia on our steps. And so I feel like he just doesn't pay attention anymore, which is great. And my kids are just like, yeah, whatever, the vulva's here today. Like they really don't care, which is nice. They're very
They need to learn
desensitized
the
to it.
real words for evolve.
Yes.
Yes, exactly. They can't call it cookie and wee wee, because when they report abuse, then it gets confused. And studies have shown that when the children use the actual correct lingo for things, that the messages are more clear if they do like reporting to adults and teachers and things.
Yes. And also the dress in the Golden Globes. I cannot remember what her name was. Everybody's like, it's the vagina dress. We're like, no, it's the vulva dress.
No,
Like, come
that
on,
would be
people.
like a really difficult.
Come on, it's the vulva. But this is the other thing I catch myself with too, is I'm very deliberate and intentional with my daughter. And I have to be better about it with my son. And I'm having to be very conscious about, I will talk to her about boy stuff in a very kind of particular way. And I've been talking to him about like, because I'm going through perimenopause right now. It's like, okay, honey, so this is what's going on with mama right now.
Right.
And this is what needs to happen. And like, again, normalizing those conversations, I think is so important, because again, like the more that they know later on in life, they're not thinking, what the hell is wrong with me? Which I think
Or
would be a very
wildly
interesting.
crazy.
Exactly. Yeah. Like, I feel like that's a super slippery slope into some sort of mental health crisis where you literally have no knowledge about what you're going through or what your partner's going through. And you think you're crazy.
Oh
100%.
yeah, I love telling people they're not crazy. It's great.
Do you have a t-shirt for that?
I should.
A button maybe. Like, I'm not crazy today. Oh my goodness.
That's one of the most rewarding parts of my job, is the look on people's faces when they're like, oh, so you're not gonna commit me? And I'm like, No,
My
we're not crazy at all. Very common.
Mine is that you don't have diastasis recti because everybody, like 98% of Northern Virginia moms in DC and Maryland, all think that they have abdominal separation and they don't.
Right.
Because they have muffin top or they have this or that or whatever, and they think they have this and they don't. They might have leakage or prolapse or other issues. We'll get to that. But no, I do love that. I get to be Oprah. I'm like, you get to do planks, you get to do sit-ups, you get to do all these things.
Yes, I had my fair share of pelvic floor dysfunction. Hey, fun fact, I ran a marathon while pregnant.
Okay. All right. So let's change gears here and go back because your kids are what you said 4 and 1. Okay.
Well, 20 months. Wait,
that's still
like
one.
A cutoff where you stop saying the months. I think it's around 3.
I forgot. Like if I went and figured out because my son's turning 13 in February. I don't know how many months that is, but it's too much. He's too much. No, that's not gonna work. So so you've been a runner for how long?
Oh, everybody will figure out how old I am. Probably like 25 years.
Awesome.
A distance runner.
Okay. Yes. So you ran in like middle school, high school, that kind of stuff too. Where did you grow up?
So I grew up in southwestern Pennsylvania in a small town called Uniontown, which is a very, very different place than Northern Virginia. I like to think of myself as very well-rounded, having lived in a variety of places.
I grew up in rural upstate New York, go north a little bit, which is very similar to Pennsylvania because we have a lot of family in Pennsylvania. So I think you and I have very similar upbringing in that respect.
I can see it.
We can appreciate all things.
That's right.
And then Pennsylvania has a boatload of hills. So I'm sure you love running hills and hill work and all that kind of stuff too.
Oh, the hill work. There was one that they had us, I swear it was just completely straight. Like it was climbing. There was no running. You were climbing up.
Ours was because you guys have it's like the top of the Appalachians. It's the what are the Pocono? I guess the Poconos are off to the east a little bit more. You guys are a little bit.
Yeah, those are further east.
Yeah, that's more east for you. Yeah. We had a lot of glacial stuff because we have the Finger Lakes in New York, which basically the glaciers kind of dig the lakes and then they dump the silt. And so our hills were straight up, but it was all like gravel left over from the glaciers. So we had sand hills too. So I think you probably just had a rock cliff that you had to climb.
Yeah, it was really rocky. It was like rock climbing.
And then marathons, like how old were you when you got into marathons?
Well, you'll love this. I didn't start doing marathons until after I became a mom.
Oh, talk to me about like what you said you were pregnant when you were training for your first marathon.
Oh, okay. So
There's a story.
Yeah, well, so COVID happened. I was always like a distance runner, not quite a marathon, like, your fun 10 miler and stuff like that. I did cross country, the 5Ks. And that was like enough for me. I also did boxing. I've been doing boxing and kickboxing for about 8 or 9 years. Then COVID, and it's like, everything shut down. And I'm like, okay, so running, which fortunately for me, I actually like running. I know most people I talk to, probably not most people you talk to because you hang out with.
We're very podcast friendly to runners here.
Yes.
Very runner friendly.
So most people that you talk to probably love running, but most people that I talk to do not. So when I tell them that I love running, they're like, why? And I'm like, you wouldn't get it. But I love running. And I thought, okay, well, instead of all the time that I would spend like in these classes and at the gym, since I can't go, I'm just going to keep running and running. And one day I just kept running and running and running. And then I didn't get tired. And then my husband's like, are you ever going to come home? It's been like 5 hours. And I'm like, babe, I just discovered that I can run really, really far.
Oh my gosh. That's amazing.
So I said, you know what? I'm going to run a marathon. And he's like, at first, but then he realized, he's like, you know what? When you say stuff, you do typically do it. So I bet you will. And then I was postpartum and I was breastfeeding. So that was like a really interesting. Have to swing by the house and pump and then go back out.
So did you deliver during lockdown or right before?
Right before. So
I'm sorry for that because I feel like any mom that like you kind of had all these ideas of how postpartum was going to be, and then you had to do it in lockdown in that weird scenario and not
Well, my
support. I just feel
second
like it was
kid
so hard.
was kind of in lockdown.
Okay.
So I did two kind of back to back. I actually liked it because there weren't too many things going on, and I didn't
Yeah.
have FOMO because I wasn't missing
There wasn't
anything.
yeah, nobody was doing anything, so there's no FOMO to have. Yeah.
Staying at home with my daughter was great because there was no temptation to do anything else.
Right.
And then I had so I think I did a whole bunch of half marathons. I did the Marine Corps marathon. I did like 2 or 3 marathons while breastfeeding postpartum with my daughter. And then I ran the Stockholm marathon, and I found out I was like slower than usual. I found out I was pregnant during that marathon with my son. And when I delivered him, that was like the whole COVID, like can't have people in the room.
Oh, okay.
So I think my son was a more COVID-y baby than my daughter.
Than your daughter. Yeah. Yeah. And Marine Corps is the best, by the way. I joke that was my second marathon, my first and my last, but I might be taking that back and changing that. But no, Marine Corps is such an amazing, if you guys haven't, oh my God, there's so many people. The Marines are freaking amazing. Yeah. It's so well organized. I cannot say that about the Army 10 miler. It's not as organized. I don't know if that has anything to do with the branches. No offense to either. Thank you for your service. But the Marine Corps, and I've done their 10K too. It's very well organized and just well done. It's just a super fun one to do.
I love the Marine Corps marathon.
For you, when you were, trying to navigate training, and this is a conversation that's really come up a lot this year, because I think more moms are doing it. And talking about it. So I don't know if moms were doing it and just not talking about it, or we didn't have the venue to talk about it. Did you do anything differently as far as like sleep or eating or how you trained when you were trying to navigate all this stuff? And then were you doing anything differently as like, was this your mental health project during this time to your physical and mental health project?
Well, it definitely helped my mental health to just get out there and run and clear my mind and listen to podcasts and be on my own and have fresh air. So definitely helped my mental health. But I don't really have a good reference point because the only marathon that I've done 5, the only one that I haven't done when I was not pregnant and not breastfeeding was the one 3 months ago, the Marine Corps marathon. So I don't have like a good reference point because I feel like I've been constantly in this like state of either being pregnant or postpartum that I don't have
like I need to see what this feels like not trying to feed another human or, grow another human.
It was weird. I thought I'd be like getting a PR or something, but I actually maybe the postpartum was like a motivator.
Oh, that's funny.
Well, it was the one where it was really hot and they had to cut it off early, and they had like so many
that was this year. Yeah.
Medical attention.
Yep. No, they changed that. So for you guys that don't know, they have a cutoff point for the bridge to basically let traffic start going again. And they bumped it. I think they bumped it in 2 spots. They bumped the bridge, and then there was a part of Crystal City that I think they cut out because it was hot, like, and the humidity was quite hot too.
So many people passed out on the side. So many people vomiting. I saw medical helicopters coming in.
Yep. The year I did it 20 years ago, 2004. And it was very similar heat, and my parents came to visit, and my mom has this picture of me running away from her on the 14th Street Bridge, and there's like some dude like flat on his face between my mom and her, and it was so bad, and I hate the heat. I don't know why I still live here, but it was dangerous too. But like I always think of like I had some clients that were running, and one of the conversations that we had was like, when it is hot and when you are training, you have to remember, especially if you are lactating, like you got to double up on the fuel, you got to double up on the fluid. Like you just don't realize how much more energy that you need and what it takes to make milk. There was, oh my gosh, I was listening, I think the Ali on the Run podcast, and there was a mom who's like she's done like a OTQ time. And I guess they did a test on her to see how much energy that she used in lactating. It was just insane the amount of training hours that it equated to. And those of us that have been milk machines, you understand that for sure. Yeah,
Yeah. Full-time
100%.
job, lots of energy, very
Yeah,
tight energy.
absolutely. Absolutely. Do you ever kind of speaking about running? And again, I'm seeing this a little bit more. We're talking a lot about energy deficit in different phases of an athlete's life. And I think historically, we've talked about the younger athlete who's, underfueling, overtraining, that kind of stuff. We're seeing this a lot now in postpartum. And I do think that there's a lot of moms that use exercise or have used exercise to navigate mental health issues, or they become kind of exercise obsessed. And then in postpartum, they're like, we need to get back to this. We need to get back to this. But they don't understand that because you're lactating, because you're not getting enough sleep, those sorts of things, you can set yourself up for energy deficiency, bone stress injuries, those sorts of things. Like, is that anything that you've kind of navigated in kind of this perinatal population?
Yeah, so I always think about this as I'm glad that I did medical school when I did, because I just had so much energy. I could hang out with friends until 2 a.m. and then get up at 6 and go run a few miles and then go to class. But ever since maybe the conception of my first daughter, it's just like I'm always tired. Um, so with fueling and making sure you get enough sleep and those types of things. So when you are running long distances, obviously you're depleting glycogen, and you have your stores, you require to hold on to water to store them. I weighed myself before and after the Marine Corps marathon. I was breastfeeding. I didn't go to the bathroom. I guess I was afraid that it would cut my time or whatever. I didn't go to the bathroom, and I lost 7 pounds. Like,
Oh my God.
From the beginning to the end. And that's just an example of how fluid shifts occur.
Yeah.
And when you're pregnant and postpartum, your fluid is just like, I did a little bit of studying like underwater medicine and space medicine, and the normal body in these different environments changes substantially, like how much, your lung capacity and volume and things. You could throw pregnancy in with being in outer space and being underwater, and the physiologic changes that you undergo. And so you got to eat different. I think the rule is you got to have like 500 extra calories a day when you're breastfeeding. And then it's really hard to figure out if on top of that you're doing distance running. So a lot of people ask, like, first of all, I didn't know I was pregnant when I did the marathon when I was pregnant. I may have still done it. People are like, aren't you a doctor? Isn't that like bad? The answer is 2 things. One, if you're not doing more than what you typically do, if I had never run and then went and ran a marathon while pregnant, like that would have been horrendous. But I was, running like 40, 50 miles a week before. So it wasn't anything different. So 1, if it's not any more than what you're used to. And 2, as long as you're able to maintain like a conversation. So when I run long distance, I am not out of breath. I'm just like chill, like, hi, singing, like if you're able to talk without being like, then you're fine. But if you are like sprinting while pregnant and doing activities where you're out of breath, then that's probably not good either. So again, 1 is you don't do any more than what you're used to, and 2, you don't do so much that you're out of breath. So that brings me to the answer to your question about fueling and making sure you're rested, is that your body will tell you. So people are like, well, how do you know how much you can do when you're pregnant and exercising? Like, if I start feeling weird, I stop. So like I did the cherry blossom. I think I was like 20 weeks pregnant. And it's like, if I feel weird, I'll just stop. Like, your body will tell you. I'm sure that statistically there's some case where something happened and nobody had a clue. But like for me, it's like I'll be dizzy or I'll feel like I'm going to throw up. And then I'm like, all right, I'm just going to walk casually. So
that's an
listen to your
interesting.
body.
So that's a funny one because first of all, like I do think we're finally starting to get more researchers researching these questions.
Yay, people
And
care.
well, and also I think too, like it's really hard to do studies on pregnant women that aren't retrospective because nobody's going to be like, "Yay, let me do this intervention that might kill
It-
my baby." Like it's hard. Let's
It's
just put it
hard
that way.
from the IRB ethics committee
Yes,
standpoint to
exactly.
get
And
approval.
even harder for like pro athletes and elite and that sort of thing. But I think, and it's funny, these questions I see on these Facebook groups where this one mom, she was like new to the group. It's like running while pregnant or something. And she's like, I'm training for my first marathon and I'm pregnant. And what do you think? And
Not first.
first of all, I'm like, why are you asking this on a Facebook group? Like, this is not your physician. And my thing always too is like, if this is something you haven't done before, now is not the time to start.
Exactly. That was item
And
number one. That's it.
it's like, but and I was very glad. I like to read through the comments before I, freak out. And everybody was like, okay, first of all, like, you don't know how this is going to be for you. You don't want your first marathon to be this way. Don't set yourself up for this. So it was very supportive of her, like, hey, great, do this, but this is not the best time. But I think what I also run into, and it's not my own mindset or personality, but I have to remind myself of that, is that there are people that, unbeknownst to themselves, are like, well, I know how to push through pain and I know how to push through symptoms and I can do it come hell or high water. Pregnancy is not the time to test that out, nor is it a time to compare it to other times. Like when you've killed yourself on a workout and you weren't pregnant and you feel crap working out in pregnancy, you should not treat those two scenarios as the same because they are not. And that's where you're saying, like, okay, listen to your body. There are people that physically do not have that connection to be able to recognize when one scenario is different from the other. And I think that's where we end up with these over exercisers that they're like, they think they are less if they are not working out 6 days a week in pregnancy or at 2 weeks postpartum, or, oh, I lost your bit. There, you're back again. Or the other thing too is they have, and I've seen this a bit too, where they have body image issues going into pregnancy, and the idea of their body changing is not something they've wrapped their head around.
Yeah.
And it really, I think that's where it can get really dangerous because you have people that it's very hard for them on a mental health basis. And maybe you can speak to this a bit more. You can't just be like, oh, well, this is just going to happen. This is just normal. And for them, it is terrifying to not have that control. Can you speak to that a little bit?
Yeah. So of course, with what I deal with is a lot of body image issues, and then you're not basically in control of your body anymore once you become pregnant. Like I said,
No,
it's analogous to the underwater or space medicine. You're physiologically morphing.
Yep.
And it's hard for people. I think not from a professional point of view, but from like just my friends and things. Since I went to medical school, I was a little bit older having my kids. So my circle, like we kind of already understood, like we're getting old and things are going to change and boobs are going to sag. Like, so from a personal standpoint, I think if it would have been like in my prime when I was super fit and then those changes, I would have been like more ticked off about it.
Yeah.
So it would be specific to the person. Of course, if they were my patient, I would be like, what is this stemming from? Did something happen whenever you were a child? So I'd have to like attack this specific trigger about the body dysmorphia and that sort of thing. But I did want to go back and clarify, because I pointed out that it's important to not start a new routine once you become pregnant. But I also said that I didn't start doing marathons until I had kids. I want to explain that I had been running already,
right,
and going to the gym and boxing, and I just replaced the gym and the boxing with even more running. So from a physical standpoint, I didn't change anything.
You didn't go to couch to marathon. Okay, got it.
I just wanted to clarify, because they're like, Dr. Waggel said to not change anything, but then she started running a lot more. Like, no, it was a substitution due to COVID. I just wanted to clarify.
All good. You are allowed to do that. No, I appreciate that. But but I like kind of what you're thinking about as far as that body image stuff, because that I do see a lot of crossover between body image, navigating that through pregnancy and postpartum, and also that feeding into energy deficiency. And a lot of these women, if you go back in their history, they do have stress fracture history. There can usually be an eating disorder history, those sorts of things. I'm lucky enough to work with some younger clients, and I'm like, we need to get this stuff figured out so that it's a non-issue, or you know how to navigate this later on, because it's going to come up again, because your
Yes.
body is going to change. It's really important to have resources available that will help you through this, because there's nothing that you can compare, maybe space, maybe underwater, to having your body go through those changes where you have no freaking idea what you're going to wake up looking like the next day or feel like, or that sort of thing. So, yeah.
Right. And this is where I actually get less cynical than I usually am. This is just my personal experience. I'm 37. When I was in high school, being as ridiculously skinny, not just in your body, but also your eyebrows being skinny, was like everywhere, plastered, every singer, TV, everything. And so I'm less cynical, because in what my observation is that is changed. I mean, I guess if you weren't hanging around in the 2000s, you might not have noticed. So I think that society is getting, this is me not being cynical, I think society is getting a little bit better in like models, and I have all types of body types, and that wasn't the case when I was in high school. There was one model that she was a rail, and that was it. So I'll give props where props due. I think that kind of thing is getting a little bit better, a little bit.
I will say yes, no, and it's funny because that conversation comes back around in perimenopause and menopause, when you have this change in body makeup and what's shifting in your body with hormones and that kind of stuff. A lot of us, I grew up in the late 70s, 80s. Our moms were fed that, like, you overexercise, you undereat, you lose weight, and then they're trying to do it again at different points in time in their life. So a lot of us grew up in the diet culture in our houses. But I very much remember, I'm going to bring your cynicism back. Sorry.
So be positive.
Yeah. Well, here's the thing. So my daughter's still in elementary school. She is very, she's percentage wise, she's lighter in weight, but taller. She's a little stick as far as I'm concerned. And one day, I think it was like after she'd eaten a meal and her belly was kind of sticking out, which is very, very normal. She told me about this conversation that the girls were having at school about their body, and, oh, you're fat and this and that, whatever. I'm like, I forget what grade this was. It was probably last year, 4th grade. And I'm like, oh shit. Like, let's have this conversation about how there are, and that's the thing that's really hard, is even though you and I are seeing differences in the models, very different than what we grew up with, and different colors and sizes and shapes and that sort of thing. How are we sowing the seeds to our kids, asking them what they're eating and how much they ate and the clothes that they're in, and little comments that we're making that inadvertently still translate into this shit where they think they are less than, or they're not thin enough, or whatnot. So it's still there. Look for it, because it's like, it's nasty, and it's in there because we question, we want to look like everybody else, and we don't want to feel different. And so sorry to bring your cynicism back, but pay attention, educate. It's a great education opportunity.
We have a rule in my house, which I'm going to have to adapt when my children are able to spell, but we'll say, like, if somebody says something, or it's in a movie, like FAT or THIN, or any comment about like, we don't use those words in the house. And because if I'm walking around saying, like, oh, like, I ate too much today, like, it's just going to get drilled into my daughter's head. And so if I do want to say that, I'll spell the whole thing out to my husband, but she'll eventually be able to spell, and we'll have to maybe text each other. I don't know. But
that will come. They will spell. And then one day, and it happened to me yesterday, my son texted me, bruh, BRUH, like, bro.
You go from,
no, we're there.
Mama, mommy,
bruh.
mom, bruh. That's the transition of your name.
I'm really proud of the fact that, like, we almost made it to 13, and it finally just showed up in a text. So I'm glad we made it this far. All right. At the end of every episode, we ask our guests a couple of questions. So first one is book you're reading or podcast that you're listening to right now.
Oh, okay. So I just bought Lady Trans Circle of Women. So it's by Lisa Singh or Lisa C. She usually writes the last book of hers I read was Shanghai Girls. And one of the interesting things I took home from that is that back in the 40s and 50s, they actually used to put women under general anesthesia when they delivered the baby, which I mean might appeal to some people, but they obviously stopped doing that. I like to read sort of a nonfiction, like something based in reality, historical, so that I like learn something. Because if it's complete fiction, you might not learn as much. And so the current book that I'm reading is about a female physician in China in the like 1500s era. And this is perfect for this podcast because most of the physicians were males. They weren't allowed to touch women. They weren't allowed to touch blood. So it was like, how do women get medical care? So her and the other females in her circle actually started doing like obstetrics, and they had some midwives, and they started doing more healthy baby deliveries than what would be the standard, is that a male physician stands in the room and then tells like a neighbor or a friend like what to do. That wasn't working. So this book is really interesting, and I wish that like more people would have been lucky enough to have this female doctor than the male doctor standing in the corner like, I'm sorry, I can't touch anything.
So that's where my profession started. So our association, the Academy of Public Health, it's the same age as me. It's 47, and it started because you had physical therapists trying to figure out their own issues, and we're like, screw it, we're going to make it up ourselves. And so that's where my profession came from. So if you want the solution, find a woman. I'm just saying.
Yes, I couldn't agree more.
Just saying. That sounds a really cool book though. Okay. Favorite activity since becoming a mom?
Oh, well, running. Well, that was
clearly
running more. Running
more.
10 miles was an activity. Now it's running 20 or 30 miles.
I was going to say, is there an ultra in your future?
That's the thing.
You don't have to decide now. We won't like hold you to it. Okay.
But probably.
Okay. I would love to personally, and now I actually have the time to do it. Unfortunately, I had hip surgery 2 years after I did my first marathon. So like navigating kind of that, but I think I might have another marathon in the tank. We'll see.
Yeah.
We'll see. Stay tuned. We'll check back in with you to see if you get to that ultra.
Yeah.
All right. Next one. One piece of advice for new moms.
Oh yeah. That probably whatever you think is not normal that's happening to you is normal, but it's just not talked about.
I love that. Thank you. And that's from a healthcare mental health professional. She wouldn't lie to you. I love that. All right. Who's somebody kind of in your space that really is kind of has you excited right now? Somebody we should pay attention to.
In the postpartum realm. Well, it's interesting. I attended a meeting. It was like a statewide type of meeting about funding for like perinatal psychiatrists and things. And one of the comments that was brought up is that they don't exist. But Postpartum Support International, I think they're trying to find, because like I said earlier, is that medical professionals and mental health professionals in general kind of get freaked out about pregnancy. So I think I'm only one of 3 in the whole state that's certified in perinatal. So I'm like thinking, I don't know, I might be the only one, but Postpartum Support International would be able to help you in your area find someone like me.
Awesome.
So that you don't have to take the silver line.
I love that. But then also, if you happen to be a psychiatrist listening to this and you're interested in perinatal health, maybe there's a space for you somewhere to dive on this. And because I think that's where a lot of physios, once they have their kids, they're like, oh, or they go through their own pelvic health issues or things like that. I think that's what spawns a lot of interest that they may not have had as a new grad. So hopefully that happens in your field, kind of like it has happened in ours. There's just a huge boom of physical therapists who are moms that have gone into pelvic health and so on. So
we gotta
hopefully
get interested, like people
yeah.
interested. Like it's a cool field, people get
Well, and
into it.
we're fun. We're fun.
Yeah,
That's a fact. I'm not question marking that.
Right.
We're fun. All right. And then last one here. What does it mean to you to be an active mom in postpartum?
Well, I think that you don't even have to be like physically active. You could be like mentally active. You can, you know, you're asking about hobbies, and then of course I said running, but actually what I've been doing are these like true crime mystery booklets that entertain your brain. They're like word searches and puzzles and stuff. So you can be an active, even if you aren't able to like walk, if you have these pelvic floor issues and you're not going to go out running, you can like sit and do puzzles and read. And so you can be mentally active too.
True crime, puzzles, and do your pelvic floor exercises. I love it.
Yeah. You can do them all at the same time.
That's my jam right now is puzzles and not true crime, but definitely puzzles. I'm totally into that. And it was a post like initial lockdown thing. I didn't do it then, but I'm totally into it now. So anyway.
I'll send you some of my puzzle books.
Oh my goodness. I love that. I love it. We'll have a puzzle club. If you would like to know more about Dr. Stephanie, you can find her on Instagram at Improve Medical Culture. Dr. Stephanie Waggel, thank you so much for being on.
Yes.
This was a blast.
And I want to throw out Improve Life PLLC is the name of my clinic.
Awesome.
We have a YouTube, but this is my professional one, but my clinic has one too. That's Improve Life PLLC.
Gotcha. And if you are in the Northern Virginia area, outside the Beltway, frankly, but that's okay. We still like you. We still like you. We'll bring our breadcrumbs out to visit and we'll stop at Wegmans. She's in the area too. So if you're, oh, totally. If you're local to the DMV, you can check out Dr. Stephanie there. Thanks so much for being on the podcast.
Yeah, it was super fun. Thank you.
Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Register now for the free on-demand postpartum mama masterclass, how to overcome the 3 most common return to run mistakes. You can skip to the good part and get back to running while missing these mistakes. Find this and more free resources under the patient section on carriepagliano.com. This podcast represents the opinions of Dr. Carrie Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.